Dr. Elizabeth Vliet is with us, Board of Directors for Associates for American Physicians and Surgeons, and Dr. Kathleen London, Doctors for America. You know, there's all sorts of complications when you don't have a freedom of people to decide what healthcare system they want to be a part of. And Dr. Vliet, it seems that the left is so desperate to win this election that they've now resorted to these scare tactics. And the question is, do you think it's going to work?
Actually, Sean, I don't. I think the American people are smarter than that, and I think the American people want to focus on liberty. I think they want the freedom to choose when, where, and with whom they have their medical care. I think they want their physicians to be determining the direction of their medical care with the patient and their families, not with the government directing what treatments are allowed, as we've been seeing in the cutbacks.
Unless you're a woman and then look state by state.
And in the screening, in the recommendations based on cost effectiveness to cut back mammograms less frequently. It was the backlash from patients and specialists in the field who brought out the issue that this was a cost effectiveness change, not a medical data change.
You know, look at the recent deceptive practices in the slush fund that was created for Medicare Advantage. And this was going to be one part of the implementation of Obamacare that was supposed to take place just before the election. So they didn't want the public to be aware, especially the elderly that like Medicare Advantage, to be aware of the changes before an important election. So they decided to run an experiment. And the experiment is, let's see what happens when we keep it the same. And then we'll fund the, quote, experiment of keeping the same so the public won't be aware of the devastating impact when Obamacare is fully implemented. There's not a cynical side of you.
That's right, Sean. And one of the things about Medicare Advantage that people don't realize is that 54% of low-income seniors choose that plan because it's low cost, but it gives them more freedom, and they are able to work within the private insurance industry and choose many different plans.
Yes, that's exactly what it is. This slush fund, as you're causing it, is a handout to the private industry. So I'm confused, Sean. Is Obamacare a takeover, government takeover of health care, or is this a handout to the private industry?
No,
Medicare Advantage is $1.14 for every dollar that it costs in straight Medicare.
You know, all I know is every Dr. Vliet that I know, and I know a lot of people in medicine, they now, here you spend 4 years, you go to college, you spend 4 years of medical school, you do an internship, you do a residency, and then you want to start an office, which is very expensive, or a practice, and maybe you join up with other people, or you join an existing practice. Maybe you start your own, but you've got to pay the rent, and you got to buy the building or rent the building and buy all the equipment, whatever that happens to be, to determine on what field of medicine you go into. And then here comes the government, or whatever form of a government-run system, even the current one, before we get to Obamacare, and they dictate what you can charge for services.
But that's what the private industry does.
Well, I'm acknowledging that that's
Sean,
partly true.
Sean,
yeah.
The issue is that Medicare and Medicaid are government-run programs that have drastically cut back reimbursements to hospitals and physicians, which limits the care available and access for patients. We suffer from
that. Medicare Advantage is the private industry. You're wrong.
Can you let her finish?
I am correct on this. And Medicare and Medicaid reimbursements in the state of Arizona are so low that many doctors have had to simply stop taking those patients because they can't afford to provide the services. That is not helpful. And when the private market, free market, is able to set the pricing in transparent ways without third parties, government or insurance, state or federal, involved, then we have the true relationship between the physician and patient, which is what medicine has always been about.
Well, let me get to one other question then. Is anybody denied emergency care because of their inability to pay, or is that against the law?
Absolutely not. That was a federal ruling in 1986, and that
an unfunded mandate
is part of why so many hospitals, particularly here in Arizona, providing a lot of uncompensated care, particularly to those here illegally. This is why hospitals have gone out of business and why we have only one trauma center left in Arizona, in southern Arizona. Mm-hmm. So there are damages to people's lives that are at stake here when state and federal government intrudes in healthcare in ways that micromanage it and make it impossible for care to be delivered efficiently and effectively.
Well,
Medicare costs
But thank you for making my point that EMTALA is an unfunded mandate that tries to get corrected in the ACA.
Well, let me ask both of you this question, because this is fascinating to me as somebody, we see Greece and Italy and Spain and Portugal and Ireland, and now the euro's about to go belly up, all headed for bankruptcy, but they all created this similar social utopia, and in most instances, some version of socialized medicine. It varies from country to country. It always has been an interesting phenomenon to me that if you look at stories that I'd read constantly out of Canada, that people with a single payer system had to wait 6 or 8 months or a year in some instances to either get a treatment or a test or a procedure because they had a shortage of doctors and a shortage of available care. You read in Great Britain with a government rationing body that they literally calculate the life expectancy, the procedure, the cost, and old people are often denied care because, well, they're not supposed to live that long. So they have to go through their life with a bad knee or a bad hip. And what gives you the confidence, Dr. London, that somehow America is not going to face the same financial difficulties which result in the same shortages that all of these other countries have experienced? What makes you think we'll do it better, especially when we start out with $16 trillion in debt already?
So I disagree with your premise to start with, because if you look at it, you're reading almost left end of it, because I have yet to meet a patient in my 21 years in medicine who comes from any of the other countries that you named who is unhappy with the system there. So you're reading about select cases, which goes on here.
Well, you obviously
never,
if you read the papers in Great Britain and you read the papers in Canada regularly, as I do, I mean, it's a phenomenon. If you look at bordering states with Canada, if people need heart surgery, I mean, they even had this one government official in Canada that went to Miami for his heart treatment and then admitted and acknowledged, even though he had supported a single payer system, that the treatment was better in Miami.
Sean, I'd like to make this comment. In Arizona, we get a lot of patients from Canada. I've had many patients from Canada and multiple countries in Europe. I regularly go to the international conferences. The socialized system is the reason that patients are coming here. And quite frankly, in India, the leading cause of medical tourism is patients escaping Britain NHS, going to India where they can get the care they need when they need it at their choice and at a reasonable price. Federalized socialized systems do not work well for patients anywhere in the world. It's been shown that they are more expensive, delays to treatment, medical outcomes, cancer treatment survival rates in the United States are far higher than any of the European countries. And in Britain, men with prostate cancer have a 51% 5-year survival versus the United States, 92%. So you can't tell me that we are not the best in the world in terms of our outcomes. The old World Health Organization data that says we have shorter survival times does not take into account the fact that the major cause of death that hits young people is motor vehicle accidents and crime on the streets.
You mean gun violence,
et cetera? Our mean survival is still much lower than any other country, westernized nation in the entire world. Absolutely, it is. And if you ask me why,
let me ask you both the question. Let me ask you both this question. If either one of you needed, God forbid, heart surgery, or if you had breast cancer, or if your husband had prostate cancer, where would you want to be treated?
The United States. My husband was treated for prostate cancer here, and his outcome is far better than the statistics internationally. And my patients with breast cancer from England come here for treatment and go back home after treatment.
Where would you want to be treated, Dr. London?
It depends on the type of cancer.
I just gave you
it anywhere.
If you needed if you had a heart problem, if you had breast cancer or prostate cancer, I'm going with 3 of the most common problems that people have.
I'm going to any of the European countries. I'd be fine staying where I am. Honestly, I'm working on to prevent that from happening, because that's my bent in life.
Prevention. I understand that, but you know what? 1 out of 8 women will get breast cancer, and the numbers for men and prostate cancer are very high as well. So the reality is...
And we haven't really improved survivability with those, despite what your other guests said.
We have improved survivability. If you look at the recent studies showing the outcomes for 16 cancers worldwide, the United States leads in all 16, and we have improved survivability, and we have done so in more cost-effective ways than any other country. We also lead the world in the launch of new cancer drugs. 50% of those over the last decade have been launched in the United States. So we are providing research and development and new drugs and innovation for the rest of the entire world.
That's true. We right now, with Americans, are saddled with paying for the entire world drug supply, and absolutely I agree with that. We pay so much more here than in any other country. And if you privatize Medicare and you get rid of the protections in the ACA, where right now seniors are getting a 50% reduction on their brand name drugs, then they will be saddled with it.
What about this? Why wouldn't you support a private medical savings account? There's a great book out that I read years ago. It's called Patient Power. And people starting in their young years would have a private account that they pay into. It includes catastrophic care if something horrible happens, either an accident or a heart attack or cancer. All of that would be covered under catastrophic coverage. But for the most part, it would entice people to get a checkup yearly, which would be important. But all throughout their lives, they develop this account, and they put that money in their account, and it's money that they, in the end, would be able to access or give to their children at some point. But they manage their own care. They pick their own doctors. They shop. But
where's the incentive to get preventive care with that?
Well,
where's the incentive to do anything?
Because
Sean, she's ignoring the fact that all of the major insurance companies encourage preventive care. There are many programs for preventive care, preventive screening in all of the private insurance companies. Every single one.
Only when they were mandated to.
No. It's included as part of your coverage that you get.
Absolutely. It's part of all the private plans I've reviewed for our employees, and that is very common practice. It has been for years.
No. It wasn't covered until the ACA insisted it be covered without a copay. I would have patients routinely come in whose PAPs and breast exams were not covered, whose preventive care was not covered. Now it is. That is a change with the ACA. You cannot deny that. I'm sorry. In the same way that you cannot deny that children with pre-existing conditions, including autism, were not covered until passage of the ACA, and it went into effect. So these are things.
We're going to give the last word to Dr. Vliet as we wrap things up here. Go ahead.
I disagree. I've had patients with children with autism for years that have had coverage under their private plans. It varies by state. And as I said earlier, when we get the state and the federal government out of mandating coverage, we can truly have a market-centered, patient-centered approach that preserves patient liberty and freedom to choose their care.
All right, guys, thank you for being with us. Very informative, and Wasserman Schultz is wrong. We'll have more on this tonight on Hannity, 9 Eastern. Quick break, right back. Newt Gingrich is next.
Sean Hannity.